Dr. Ali specializes in performing and reading diagnostic imaging, including echocardiograms, TEE, nuclear, and CT scans of the heart, as well as vascular imaging. Dr. Ali treats his patients as he would his own family and has the best interests at heart. He currently is accepting new patients at his offices in Hinsdale and Plainfield and works to serve his community. So without further ado, I'd like to welcome Dr. Ali.
Thank you so much. Thank you for this introduction. Thank you so much for having me to talk about this very important topic. I would like also to thank all the audience for taking the time to be with us today, just to kind of share the awareness about this important topic. So I would like to start talking about the title. I think it tells about itself: know your numbers and lower your risk. So in order to know about your cardiovascular risk factors, there's two important things. There's two cardiovascular risk factors. One of them we call modifiable risk factors. The other one it's non-modifiable. And it means that some risk factors for the heart disease and the stroke, you have no control over it. Your age, the gender, and the family history. Those are the things that we cannot control it. But definitely there's other cardiovascular risk factors that we can control it, and it's really important to know about those risk factors so we can prevent significant cardiovascular events. And these are the most important. It's not everything, but these are the most important. And where the ACC, the American College of Cardiology, and the American Heart Association, they would like to focus on these numbers and make sure everyone is aware. What's your numbers? What's your goals? What should you be aware of? And cholesterol is very important thing. We'll talk about your blood pressure, what's the numbers, your blood sugar, the BMI, and the triglyceride are the main risk factors that you have to be aware of it. When it comes to this slide, it scares me actually, and I'm sure it's gonna scare you, because if you see all these numbers and you don't want to be one of those, basically patients, 23 million adults with type 2 diabetes. There's 15% adults who smoked in 2015, and the numbers definitely are greater in 2023. And 56 million people 40 and older who are eligible for cholesterol lowering statins. I don't want to keep going because the numbers are scary, actually. That's why we are talking about this important topic, so we can prevent significant cardiovascular events. And this slide actually it will tell you what are these numbers and what are the goals for them. So I'm gonna just briefly mention about these numbers, then we'll talk about each one separately. So remember, for the total cholesterol, it should be less than 200. So you're in a safe zone at least. Then remember the LDL, which is the low density lipoprotein. It's your bad guy. So remember that name and that number. Your LDL should be less than 100. That's the optimal goal for you. And I want to mention also, if you have already established cardiovascular disease, like old heart attack or stroke, any peripheral vascular disease, so your goal should be less than 70. So less than 100, this is for someone who does not have established cardiovascular disease. If you have established disease, then definitely the goal should be lower and less than 70, just to make it clear for everyone. Then if it's 100 to 129, this is kind of, borderline. 130 above 59, again, it's a little bit high. 190 is very high, and that number also you have to be careful, because if you have 190 for the LDL, then this is by itself where the guidelines, you need medication basically. You cannot be on just like a lifestyle modification. You should be on medications. But in general, remember, bad guy is the LDL and should be less than 100. Your good cholesterol is the HDL, the high density lipoprotein, and it should be above 40 for the male and above 50 for the female. For the triglyceride, it's less than 150. Your blood pressure goal, less is better. So if it's less than 120, the first number, and the bottom number less than 80, that's normal. That's your goal. For the blood sugar, it should be less than 100, and there is something called the hemoglobin A1C, and basically this is a blood test that will check your blood sugar level in the past at least 2 to 3 months, and it should be less than 7% as a goal. Your BMI or body mass index, it should be less than 25 kilogram per meter square, and we'll talk about how we can calculate that and what's the importance of it. I just mentioned briefly here also there is other important number that you should be aware of. It's the waist circumference, because it will tell you how, are you overweight or obese based on that numbers. And if the numbers less than 35 inches as a female, that's good, you should keep that. Less than 40 inches for the male is your goal too. And definitely exercise is it's very important. You have to exercise at least 30 minutes of moderate physical activity each day, 5 times per week. That's kind of, the recommendation from the American College of Cardiology. And now we're going to talk about each one separately. We'll start with the blood pressure. Blood pressure is very important. Hypertension, they used to call it, and it's the silent killer. Because, I've seen patients, there's like, I don't have any symptoms of high blood pressure. You're not going to feel any symptoms. Your blood pressure might be very high and you have no symptoms. That's why it's very important to check the blood pressure, especially when you go see your doctors, even at home, every while, and then you should keep checking the blood pressure and make sure it's within the normal. What's the normal? Again, less than 120/80, and the definition of blood pressure is the force of the blood against the arterial wall. And there's 2 numbers. The top number, it's basically when the heart contracts, that force against the arterial wall is the top number. The bottom number is when the heart actually relaxes and it's not contracting. There is a force against the wall, and that's the bottom number. The top number we call the systolic, the bottom number we call diastolic, and your goal should be less than 120 and less than 80 for the bottom number again. And this table, it's very important actually, because there's a lot of changes, from previous guidelines, and there's still some difference between the European and the American guidelines to define the blood pressure. We used to define hypertension as 140/90 on 2 separate occasions. That's your hypertension definition. Now, the new guidelines, they call 130 and above to 139, 80 to 89, the bottom number is stage 1 hypertension. So this is different from about a few years ago, when we considered 140/90 is the cutoff to define hypertension. So the lower number is better, definitely. Should we be on a treatment for that? This is another topic that we can talk about later, but at least 130 and above, 80 and above till 89, this is considered hypertension on 2 separate occasions. If it's 140 or above, 90 and above, this is stage 2, and you should be on medications. If you check your blood pressure on 2 separate occasions and still 140 and above or 90 above, then definitely you should be on a medication, and this is stage 2 hypertension. Anything beyond that, it's considered, hypertensive crisis above 180 and the bottom number above 120. So that's something very important. You have to talk to your doctors if your blood pressure is more than 180 or the bottom number more than 120. Shifting gears, so we're gonna go to the second important number is the cholesterol. So what's the cholesterol? Just briefly, I wanna define it. It's a fat-like substance in the blood. So cholesterol by itself, it's not only fat, it's fat-like substance. And is it really important to have cholesterol? Without cholesterol, actually, we cannot live. We have, the cells in our body is made by cholesterol. Significant hormones, it's made from cholesterol. The estrogen, the progesterone, the cortisol, all these hormones are made from cholesterol. So we need cholesterol, but we need it in certain amount. Excess amount of cholesterol is bad. And basically, the 2 main sources for cholesterol is the food. So we get about 15% of our cholesterol from diet, and there is about 80 to 85% of the cholesterol is mainly made from the liver. So our liver will synthesize that, but the cholesterol cannot, go in the blood without having a carrier. Those carriers are the proteins that will carry the cholesterol and just basically spread it in the cells to form these hormones and build up your cell membranes. So these proteins are the LDL that we spoke about just briefly, the low density lipoprotein and the high density lipoprotein. So the bad one is the LDL because it carries the cholesterol in the blood, and if there's excessive amount, then those cholesterol, it will deposit in the arterial wall, and it will increase your risk for heart disease and stroke. The other one is the HDL. So HDL, basically, it will do the opposite. So it will kind of, take the excess cholesterol from the wall and, send it to the cells to build up, other stuff, basically. So that's why it's the good cholesterol, because you don't want to, cholesterol to be precipitated in the arterial wall. That will form the plaque that will, God forbid, rupture and give you the heart attack or the stroke. So remember, two cholesterols. One of them is really good cholesterol that you want to keep it high. Thumbs up. It's HDL. So you need the HDL above 40 as male and above 50 as female. For the bad, the LDL, low density lipoprotein, remember, should be less than 100, and your goal less than 70 if you already have heart disease or stroke in the past. Very nice slide to, show you the numbers again. 100. Then 130 to 159 considered high, 160 to 180 actually very high. Another number to remember is the 190. If you hit 190, then you should be on medication regardless. We cannot do anything, just lifestyle modification and diet. At that point, you should be on cholesterol lowering medication per the guidelines. And again, the LDL, it's the culprit behind most the cholesterol buildup and arterial blockages. You should check the LDL basically every 5 years, starting at age 20. So remember that. Even young people, especially people with family history of high cholesterol, they should check their cholesterol at young age. We get these questions: what should I do? How can I watch my diet? What should I eat? This is a very nice slide, actually. It will just simply tell you, enjoy something, limit other stuff, then you have to avoid certain food. And if you just look at this slide, vegetables, fruits, whole grains, beans, nuts, the animal proteins, fish and seafood, you have to enjoy those because those are rich resources in good cholesterol, basically, and it will not increase your bad cholesterol. You have to limit sweetened drinks, alcohol, sodium, red and processed meats, carbs, all these very bad. It will increase your cholesterol and triglyceride. You should limit them, and you should avoid all the trans fat and the partially hydrogenated oils, which is usually found in the baked and fried foods. So fried foods, something you have to avoid. So enjoy, limit, and avoid. This is your goal. The next one is that triglycerides. Triglyceride is basically fat. So cholesterol, we said it's something like fat, but triglyceride is fat. And if you understand the concept that it comes from fat, so fatty food will increase your triglyceride. If you understand the concept that carbs, if in excess amount, it will convert to fat, then if you eat a lot of sugars, it's going to convert to fat, then your triglyceride will be high. So if you have diabetes and it's not controlled, your sugar is high, the sugar will convert to triglyceride in your body and deposit as fat, and you're going to have high triglyceride. Excess amount of alcohol also, it will increase the triglyceride. The goal for you should be less than 150, another number to remember. So less than 50 is your goal. If you hit 500, then also you should be on medication. Remember, alcohol, obesity, smoking, diabetes, because a lot of sugar, diet high in sugar again and carbs, menopause and family history, all these factors, it will raise your triglycerides. Very nice slide. What you do, you should lose weight, exercise, switch to fish from the red meat, basically. Then alcohol, you have to kind of, moderation, basically. And definitely you need to consider medication, especially if you hit 500. So remember, 500, it's a high number that you maybe need medication, so you have to talk to your doctor about it. Then the next one is the blood sugar. Again, diabetes, as I mentioned earlier, the number of people who have diabetes, like million, it's worldwide. It's not even in the US, it's everywhere, basically. So we have to be careful. You have to check it, and make sure, especially if you have family history. The normal is the bottom one, should be 100 or less. Fasting, we're talking about fasting. Blood sugar, if you check it, it's a blood test. You check it when you're fasting for 8 hours. Then if it's less than 100, this is normal. And the other test we spoke about is the hemoglobin A1C. It will check the 3 months in the past. It should be less than 5.7. And usually they do it on 2 occasions. You have to do it twice. So if you do it fasting twice, or fasting and the A1C, and both of them less than 100, 5.7, these are kind of, the numbers for you. The ABCs of diabetes: make sure your A1C less than 7%, make sure your blood pressure is less than 120/80, and your bad cholesterol less than 100. The next one is the body mass index. You can, use the calculator. It's online. It's easy. Just you have to put your weight and your height and do the calculation. Is it important to know your number? Definitely, because you want to see, are you underweight, are you normal, overweight, or obese, and all these will put you at higher risk of cardiovascular risk if you're obese or overweight. The cutoff, the normal, just remember 18.5 to 24.9, less than 25, just like simply, just if it's less than 25, then you're good, you're in a normal range. If you're above 25, almost till 30, then you're in the overweight category. You have to be careful. And if you hit the 30, this is obesity, and you kind of, you have to work on your diet and exercise and lose weight, because again, obesity is a significant risk factor for cardiovascular disease. And that will lead us to this nice slide. Actually, we spoke about the numbers. We did not mention this earlier, but ASCVD is the atherosclerotic cardiovascular disease. It stands for this, and it's an online calculator you can use. Just make sure you use the ACC calculator, because it's the most accurate one, basically, and those numbers are based on the ACC guidelines. So this is basically will tell you what's your 10-year risk of having cardiovascular disease compared to the other, basically, population. And it will categorize people into low risk, less than 5%, then borderline between 5% to 7.4%, above 7.5 to 19%, then high risk is more than 20%. And it's very important, because sometimes we get patients, they have cholesterol high, it doesn't meet the criteria for medication. It's not 190, they don't have significant indication, and they will ask you, will I benefit from statin, which is the cholesterol lowering medications? So there's different tools that we can use to help us as physician and guide us to see, should I put you on a medication, or we can just continue with lifestyle modifications? One of these tools is this one, this calculator, the ASCVD calculator. And based on that, if your numbers is in the intermediate, or in the high risk, definitely I would say, yes, you need the high intensity statin. If it's in the intermediate risk, there's other things that also we can use to decide should you need a medication or not. And even bear the new guidelines, because we spoke about the hypertension and the new numbers for the high blood pressure. If you're having high blood pressure of 130/80, this is hypertension on 2 separate occasions. And should you be on a medication, then I can use this calculator to see if I should put you on a medication or just continue with lifestyle. If you have ASCVD risk of more than 10%, the guideline says you should be on a medication, even if your blood pressure is 130/80 only, and it's not 140/90. So it's a very nice tool to use it's mainly for us as physician to kind of guide us. Should we start medication, which is either the cholesterol lowering medication or even for hypertension? So, and it will tell you what's your risk for heart disease, stroke in general. This is, I think, the last slide. Life symbol 7. Actually, those are the 7 things that you should do, I should do, to kind of reduce our cardiovascular risk. Get active, eat better, lose weight, stop smoking, control your cholesterol, manage your blood pressure, reduce blood sugar. These are the numbers that we spoke about, and we would like to keep them optimally controlled and within the goal, so we can basically live longer, healthier, and avoid cardiovascular disease. Thank you so much, everyone. I really enjoyed this, and I appreciate your time. And thank you, everyone who arranged for this talk.